Alright, in this video what I'll be doing is taking you through the Advanced Data Systems Electronic Health Record Solutions method of e-prescribing. The product's called Medics Doc Assistant. It's CCHIT certified for meaningful use. And let's jump right into it. What we're looking at on the screen here is the home screen of our EMR. So right after you log in with your username and password, you'd have a listing of all of your scheduled patients here in your home screen, demographics at the top, patient's photograph. And what I'll do is click New at the bottom, then General, to start a new encounter here. Internal medicine flow in this case. We do have specialty specific content. And we always start out in our dashboard tab where you can get a feel for the patient's clinical history. You can see current meds here, all of your other info. But for today's purposes, I'm going to jump straight into the diagnosis tab. And then with one click on medications, this link, it'll bring us to that section of the electronic health record. Okay. Now when I click on Add Edit Meds under Diagnosis Medications, that's how we prescribe new medications using our interface to SureScripts, our e-prescribing partner. When I click on Add Edit Medications here, this screen pops up. You can see immediately the patient's allergy list and current medications. The system does drug-to-drug and drug-to-allergy interaction checking, so it'll cross-check the patient's allergies and current meds and let us know if there's any conflicts there as soon as we prescribe a medication. Now, as far as prescribing the med goes, there's two different ways you can do it. You can search for any medication in the FDA-approved database by typing the first few characters and then doing a drug search. When you do a drug search, you probably want to save that for uncommonly prescribed medications because you're going to have to go in there and enter in the numbers, the frequency, the refills, all that information that you probably, for your most common medications, would have saved into your doctor's list over here. And the doctor's list is basically a favorites list of all of your most commonly used medications. So if I click this list, the button, we'll get a list of all of this provider's specific favorite medications. And I say this providers because each provider in a multi-provider environment can have their own favorites list with their own favorite medications here, and that's what this list is. And you can see also what medications are in formulary for this patient's insurance. Okay, so the system's also cross-checking your formulary information, so you can reduce phone calls from the pharmacy for change requests because of the insurance's preferred medications. Okay. Now to prescribe a med, I just scroll to through my favorites list here and say, all right, I want to do the Lipitor 20 milligrams twice a day. All right, 120 tablets. One click in the checkbox, and then all I have to do is click Select, and that enters it into my list right here. Now all I have to do is click Take Complete RX to Review page, where I can review the prescription. Now if I needed to print this out, just so you know, you can always print this prescription right to the state form. So if the patient wants to go somewhere that's not doing e-prescribing, it's a mom and pop pharmacy, they do have that option, or you do have that option here. But for today's demonstration here, I'm going to hit Transmit RX, which then pulls up a list of all of my e-prescribing pharmacies, my favorite pharmacies here. But you can also search for any pharmacy in the country by clicking Add Pharmacy. And then you can search by zip code. It'll pull up any e-prescribing compatible pharmacy. You can tell they're e-prescribing compatible because of this column, ERX. There's a green orb. At the bottom here you can see the key. That means they're e-prescribing pharmacy. There's another orb over here that's brown in color. And those are the patient's default pharmacies this patient's used in the past. So right away, if you're sitting there with the patient or in the exam room with the patient, you could say, do you want to go to the CVS here on Harrison Street in this case? They say, okay, sure, that's where I want to go. You click the link, like I'll do right now, and it selects that pharmacy to the table here. Now all I have to do is transmit this directly to the pharmacy. And I can do that by just clicking Transmit RX. Now it's been sent out to the pharmacy. All the patient needs to do is arrive at that CVS, show their identification, and their medications will be filled. One final step is to click Transfer here, and it takes the medications we prescribed today and enters them into the Medics Doc Assistant Diagnosis Medications table. So we have a log locally in our EMR and our patient's record of what we've prescribed. So we know when it's time for a refill, and we know exactly what happened with this patient's medications next time the patient comes in. Well, that about wraps up the high-level overview of e-prescribing from Advanced Data Systems with our Medics Doc Assistant EMR. And if you have any questions, as always, just give us a call or email us at info@adsc.com, and we'll get your questions answered and maybe set you up for a full presentation. Thank you for your time today.